I'm Professor Fit RN, and during this quick short, I'm going to go over the 5 parts of the nursing process. So let's begin. The first part of the nursing process is to assess. Here is where you do your assessment, which may include listening to the patient's heartbeat, touching parts of the body to determine if they're warm, cool, or if they're normal to touch. Also, assessment consists of you asking questions. Here is where you may ask the patient about their history. Next is the nursing diagnose. During the nursing diagnose part of the nursing assessment, you analyze and interpret the information that you gathered during the assessment. Also here, you should develop a list of nursing problems that the patient has. Therefore, you are diagnosing what is wrong with the patient. You are doing a nursing diagnose, not a doctor's diagnose. There's a difference. The third part of the nursing process is outcome and planning. Here is where you select the nursing interventions that you are going to do. Not quite do yet, but what you are going to do. Also here, you are going to prioritize. What are you going to do first? You are coming up with the patient's care plan. You are preparing to do. You haven't done anything yet, but you're preparing in the outcome and planning part of the nursing assessment. The fourth part of the nursing process is implement. To me, this is one of the easiest parts of the nursing process to identify in a scenario because it means doing. When you implement something, you do it. If you decided in outcome and planning part of the nursing process that you needed to give the patient something for pain because none of the other methods that you had tried worked, then when you call the doctor, that's implementing. And you may have a question that uses a scenario on your test, and you have to be able to identify what part of the nursing process it is. Implementing is doing. So when you call the doctor, you are doing something. And when you give the patient the Tylenol, you are also doing it. But when you are thinking, okay, I don't have an order for pain medication, I need to call the doctor, that's outcome and planning. When you actually do, that is implementing. Also, during the implementing part of the nursing process, this is where you're going to carry out the care plan. Whatever those interventions are that you chose in outcome and planning, those interventions are part of the implementing part of the nursing process. This is where you carry out those interventions and you do. So anytime the nurse is doing something, remember, it's going to be implementing. The fifth and last part of the nursing process is evaluation. Anytime that you do an intervention for a patient, you should go back and determine if it worked. Maybe it did work. Maybe it only partially worked, or maybe it didn't work at all. So if it didn't work at all, or if it partially worked, guess what? This is also where we modify the care plan. So, regarding fundamentals of nursing, if you are presented with a scenario on a test and you have to determine what part of the nursing process they are talking about, remember, the best way to prepare for this is to go to your book. Most likely there's probably a chart in your book discussing what is going on with each part of the nursing process. Yes, you do need to understand what's happening during assessment, what's happening during diagnose, outcome planning, implementation, and evaluation, because there would be scenarios where you have to say, Oh, okay. This is the implementation part of the nursing process. You have to understand it. So go back to your books and make sure that you read, and make sure that if you are presented with a scenario on the test, that you can identify that part of the nursing process. Hey, don't forget to subscribe, like, and share.